Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Bowtie Cinema 11 at Reston Town Center on Sunday, March 23rd at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Love to talk to you today on any subject that you have in mind. I've got a couple things that are in the news and want to kind of share with you. It's been a very interesting weekend for me. I've been teaching at the Florida Chiropractic Physicians Association convention, and just some really interesting topics and presentations, and a couple things that really got my attention. And one was on heart disease and cholesterol, and we're going to share that with you a little bit. And there was articles that were written about a year ago by the traditional allopathic community that I want to bring to your attention because they were brought to my attention, and I think you need to know the information on that. But nevertheless, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. Just give me a jingle, and if you'd like to talk to me off the air or send me a text message, you can do that by going to rosellecare.com. That's ROSELLECARE.com. I have the opportunity to teach all over the country, and it's fun, it's intriguing. I love to, play with doctors who sometimes get themselves in a box and compartmentalize their thought process. And, unfortunately, it's not limited to the allopathic community, but it's also in the natural healing professions as well, because everybody thinks that they have the answer. And what you really need to know, and what doctors need to know, is that when you look at things from a multidisciplinary approach, you begin to really understand the why behind things, and that's critical to really getting through any type of process to be able to help a patient. And we're in an environment today that every patient has to be the center of everybody else's attention. So what I teach on is integrative care, how to look at a patient multidimensionally and then prescribe the care that's necessary without drugs, without surgery, obviously, from our point of view. But let's get to a couple interesting topics, and I'll tell you more about that as we go through. But again, 888-630-9625. There was an article that was released about a year ago, and it was very interesting. It was talking about the fish oil supplements that we all take, many of us take, that you should be taking. And it basically was off a research, if you want to call it research, platform that the traditional medical community did. And basically what they said is that omega fatty acids, omega-3 fatty acids, the things that you should take for, keeping your blood thin and making your heart work better and so forth, didn't have any effect whatsoever. So it says, it starts out and says, fish oil supplements found to be of no benefit to high-risk heart patients. Well, in 37 years of clinical practice, starting my 38th year this next month, if I didn't have omega-3 fatty acids, if I didn't have fish oils at my disposal, I don't know what I would do for my patients who had heart disease and had potentials of stroke and cardiovascular problems and so forth. Yet a major medical study was just right there in your face and said, you know what, this stuff doesn't work, that omega-3s do not help heart disease patients, and that they call it the fall of the omega-3. That was kind of an interesting term, but this research came out, and it was actually 2012. And I've had several patients talk to me about that, but here's the skinny on it. Here's what I really want you to know. So how could our practice and many other conservative care practices have totally different outcomes? It's really simple. And when you understand this is one of those, the way they manipulate the game so they can come up with their own conclusions. So how did they manipulate the game? They came up with the correct conclusions, by the way. So let me say that. Their conclusions were absolutely, positively correct. But that said, they also put out this that if you ate, salmon and, with the wild-caught salmon, it's good for your heart. And it's true. But they said taking fish oils doesn't help at all. So, again, what's that all about? Well, here's the deal. They didn't use a good fish oil, and the amount that they used was almost nil. So your body can only use supplements made from whole foods. Now, remember that. And when you buy anything from a natural food store, you order them online, if they are not natural products, 100% natural products, and we're talking about fish oils, and in this particular case, coming from fish that are wild-caught, not farm-raised. And many of your fish oils come from farm-raised fish. So they have to be in a raw state. They have to be minimally processed, if anything. They can't be adulterated with any other external type of product. And it has to just be how God made it. It has to be from nature's storehouse. In the study that I'm talking about, they used 1 gram capsules of a highly standardized, highly processed fish oil. And it was tested against a placebo. So they're doing their double-blind study. And guess what? It failed. Just as I would have predicted if you had asked me about that, it's going to fail. They're going to come up and say this stuff doesn't work. So what's 1 gram of fish oil? Well, it's about 1/5 of a teaspoon. You got to be kidding me, right? 1/5 of a teaspoon? It just doesn't make any sense if you're going to do any kind of intervention. And even this 1 gram of fish oil that was highly processed, heated, it was deodorized, it was stripped of anything that was natural, all the naturally occurring vitamins and nutrients and so forth weren't there anymore. And it was no longer a whole natural food. So 1 gram of even a great fish oil, by the way, wouldn't do too much good. A little benefit, but not a whole lot of anything. But 1 gram of poor quality oil absolutely, positively did nothing, and their conclusions, therefore, were correct. So it simply proves my point and my hypothesis. Synthesized, fractionated, industrialized, processed supplements are basically useless. You can throw them out. And when you go into any of the stores and you're looking for cheap, trust me, that's what you're getting. You're getting something that doesn't work. Synthesized, processed supplementation look good, and they can be made cheaply, and that's why they put them on the market. But the bottom line is, when you're looking to prove a point, you find the product that will prove your point. So in this case, medical researchers actually had their conclusions totally on track. They were right, even though their conclusions, based on what they did and how the study was structured, were absolutely wrong. So they said that foods rich in omega-3s are good for your heart. Absolutely. But typically store-bought fish oil is useless. And that's true as well. And I'll tell you that that's true because most of the stuff is synthesized. You have to get good stuff. So when you take an inferior fish, you press out the oil, you heat it up over 500 degrees, you deodorize it, you clarify it, you remove all the natural vitamins A and D, and you replace it with cheap synthetic versions of this stuff. And then you charge, for a huge bottle of this garbage, $50 for it. You're ripping people off. You're lying to them, number one. If there's any marketing that goes behind it, you're lying to them, and you're taking their money and saying, thank you very much, but I'm giving you an inferior product. These products really warrant the AP headline that reads, fish oil, not a magic heart pill. Well, you know what? It's all because of the way it was structured. When you structure something to get the results that you want, you get the results that you want. It's kind of crazy, but that's the way it is. So it's about the processing. So we have to make sure that you're getting natural supplements, natural substances. But omega-3s are definitely effective. And there are natural products that are out there. There are things that work very well. You know, when I give my patients fish oils, and they have all kinds of problems from, you know, arrhythmias to, you know, heart disease to heart failure to fibrillation. You know, we're treating them not only just with that supplement, by the way, and they work. And there's many studies out there that show that they work. And this study was debunked later on. But the reason I'm bringing it up is because two things. One, I listened to a really excellent presentation this weekend on cardiovascular risk and what EKGs show before and after certain types of supplementation. But nevertheless, when you use supplements, they have to be natural. And that's the whole reason I'm bringing this up to you. You really have to be careful. Don't get caught in saying, buy this cheap brand of this garbage, because, you know, you're going to save some money. Unfortunately, when it comes to good nutrition, good supplementation, often it's not inexpensive, but you'd have to go to the point of how do I do my own stuff, and that's a whole different subject. And one of these days we'll get Sue on the program, and we'll talk to her about that. But let's talk a little bit more on the subject or similar related subjects, because, as I said, I kind of got my interest this weekend. Remember, when you look at any organ system, particularly the heart, remember that the heart has three electrical sources. It has a pacemaker. It has the nerves from the upper portion of your back. It has the nerves, one of the nerves from your cranium, from your brain. The vagus nerve, parasympathetic nerves from your spine, and then the pacemaker within it. So we have to, you know, make sure that we don't compartmentalize things. So doctors, you know, are beginning to use a wider range of application to the statins that are out there. So here's the other thing that got my interest and kind of tweaked my tail some. So guess what? Profits from statins, you know, these are drugs that lower fat, right? Lower cholesterol, you know, are dropping. Yeah, they're dropping. So lots of people are getting smarter. That's what the whole deal is. They come to see people like me who say, you know, get off that garbage because they don't work. There's studies out there that says that, you know, statin doesn't fix anything. Remember, if you listen to the program over a period of time and in years, you're going to hear me say it's not fat in your bloodstream that's going to cause you to plaque. It's the inflammation that causes the fat to plaque. And whether you have a little fat or you have a lot of fat, you're still going to plaque if you're inflamed. You know, several statin drugs are coming off patents right now. And see, we have this great thing in this country. It's called patenting. And when you patent a drug, you get to get all the profit from it. And, you know, so making them available now for very little, about 10 cents a day, you know, what's a good pharmaceutical company to do? How are they going to work this out? Well, they have to get doctors to recommend that millions more people need these drugs, and they need to have them prophylactically, and they need to have them for all kinds of problems. So in an effort to prevent heart attacks and early strokes, and doctors are calling on this craziness, you know, 1/3 of all adults to start taking statin. 1/3, whether you have a heart problem or not. How many of you gone to your doctor and you said, here, you're 50 years old, you're 55 years old, I want you to take 81 milligrams of aspirin as a preventative, as prophylactic? Your body wasn't designed to have a drug in it. You are not drug deficient. You have a lifestyle that kind of screws things up a bit, but you're not drug deficient. You have other problems. You've had injuries that cause the nervous system not to communicate properly, but you're not drug deficient. So you have this pharmaceutical marketing economic equilibrium that wants you to make sure that they have profit on an annual basis. Yeah, am I going after the drug companies again? Yeah, I guess I am. You know, but that's the way I do things. So here's the new guidelines from the American Heart Association and the American College of Cardiology. You know, the docs on these panels, you know, half of them have financial ties to these companies, right? So it's like, you know, putting the wolf in with the sheep or the chickens. It's just, you know, it's not working really well. You know, so if they have financial ties to these companies, do you think they're going to be objective in their assessment of these different drugs? Let's say despite a small increase in risk of muscle problems and accelerating diabetes, statin drugs are remarkably safe. Did you hear what I just said? I said despite an increased risk of muscle problems and accelerated diabetes, statins are remarkably safe drugs. Amazing what they do with marketing. We're going to get into that a little bit more. We're coming up to a break. I'm here at 888-630-9625. That's 888-630-9625. Love to talk to you about your problems, and if you're on some of these medications, what you need to be aware of. That's why I'm here, to bring you the truth. And today's going to be the Truth Day. We're going to give you a lot of data. Don't go away. This is Dr. Tom Roselle. I'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. I'm at 888-630-9625, waiting to take your phone calls. We're talking about some interesting topics today. And why are they interesting? Because you are being duped by marketing and drug companies, and I need to let you know what the truth is. See, that's what happens when I go away and I teach for a couple of days. I've been teaching, as I said, this weekend at the Florida Chiropractic Physicians Association convention in Orlando, and there was some very interesting presentations that I intended, in between when I was teaching, and so it just kind of lit my fire. So I did a little work for you and stuff that you need to know about. And we're talking about statins right now and the fact that they, other than the fact that they increase diabetes and, they cause all kinds of muscle problems, they're really relatively safe drugs. Is that true? Yep, that's absolutely true. No, it's not true. So what's the real truth on these problems? Well, muscle problems caused by statins can become so severe that they can put you into a wheelchair. Did you hear what I just said? They can actually put you in a wheelchair because your muscles get rigid, they hurt, they get painful. Statin drugs are associated with lots of other problems. And what are they? Well, folks, some of you that have cataracts and that you're losing your memory, guess what? Those can very directly be related to statin drugs. So if you're on those medications, you better think twice about them. And can it induce diabetes, really? Yep, absolutely. So I guess these are what they call small increased risk of health problems. I don't know about you, but I don't think I want any of those things. But did you know that the early Lipitor, another statin drug, ad said that in very, very fine print, that Lipitor has been proven to prevent heart attacks, has not been proven to prevent heart attacks or stroke? I mean, yeah, so why are you taking the stuff? If it hasn't been proven to work, why would you take it? There's some questionable statistics out there, and a synopsis of all the studies can be found in a very interesting and conclusive website. Go to www THENNT.com, and do some research. But I want to give you a little bit more data. So for people with heart disease who took statins for at least 5 years, 96% of these people, in this across-the-board study, received zero benefit. 1.2% were saved from death, 2.6% were spared a second heart attack, and 0.8%, 0.8%, were spared a stroke. 96% of the people who took statins had no benefit whatsoever, but the problem is that the side effects that causing other things were significant. So for those without heart attacks, now those are with people who had heart disease. These are people who have no evidence of heart disease, but your cholesterol got too high, so your doc wanted to put you on cholesterol drugs. So docs, be careful when you do this with your patients. So these people who've taken a statin for at least 5 years, 98% received zero benefit. 0 were saved from death. 1.6 were spared a heart attack. 0.4% were spared a stroke. If you had a heart attack, we know that the following 3 to 6 months after that are extremely critical. For those taking a statin starting within 14 days of their heart attack, the gold standard in medicine, after 4 months, 100%, if you were put on a statin, 100% saw no benefit whatsoever. None, zero, nothing. But they don't even know how many people were harmed because of taking that. The data is crazy, my friends, and you really need to know what you're doing. Do your own homework. Please do your own homework. If you're not willing to do that, then you become the scapegoat for the drug industry and bad medicine. And I'm not telling you that all allopaths are bad people. There's some wonderful, wonderful people who really get it. They understand it. And they're out there, and you need to find them, and you need to educate your own physician. Let's go to the phones. Charles, how can I help you?
Yes, my cholesterol reading was 233, and the LDL was 150. My question is, should I be concerned about those readings, and is there any kind of foods that could bring down the cholesterol?
The answer is you might be concerned, but I need to know a whole lot more about what your fats are. So I need to know what your triglycerides are. I need to know what your HDL. I need to know what your VAP analysis is. Those are the small breakdowns of the different good and bad fats. They're called apolipoproteins A and B, and they tell you what your real risk level is. Some people, particularly if we get older, a higher cholesterol is natural for them. It's genetically the way it's supposed to be, and it's actually, and for many people, it's protective. But do you know what your triglyceride was?
I know it was normal. I don't know the exact number, but it was in the normal range.
Yeah, generally it's the laboratories say anything under 150. I say anything under 100. Do you know what your blood sugar was?
It was, I think, about 90.
Okay, so most of your studies today are going to tell you that you want to keep it under 90, but you have to look at all of it together. And so the short answer is that without knowing all those other pieces, the conclusions can't be made. Listen, I'm going to hold you on. Don't go away. I've got a break for the news. But I want to ask you a couple more questions because you're on topic, and I think it's information that everybody would benefit from.
Okay.
This is Dr. Tom Roselle. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. You're listening to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live today. 888-630-9625. That's 888-630-9625. Spent the weekend in Orlando teaching at the Florida Chiropractic Physicians Convention. And great minds here, guys that really have their act together. A lot of very interesting topics. A couple ones got me all lit up in between my sessions, and we're talking about cardiovascular disease and statins and all the things that you're meant to believe, and I want to get back to those. But Charles, you're still there?
Yes, and by the way, my triglycerides were 141 and the HDL was 56. The LDL was 150.
Okay, so your HDLs are great. Your triglycerides, as far as I'm concerned, are a little too high. Do you happen to know what your coronary C-reactive protein is, CRP level?
No.
Okay. So the things that I would need to know is how much of that bad cholesterol, the LDL, and those are actually proteins, are small, dense molecules instead of fat, buoyant molecules. That tells you what your risk level is. But can that stuff been brought down? Yes. So what you look at is you look at the level of inflammatory response that the patient has in their body, and you evaluate that based on lifestyle, diet, their sleep patterns, and so forth. If you're not sleeping properly, if you're not sleeping well, then your body's going to increase inflammatory response, and you're going to increase your risk of plaquing, even if your cholesterol was 164. So can you get it down? Yes. You have to look at diet. What kind of diet? Just as a broad brush, and we do dietary patterns very specific for patients, but if you look at your plate, you want half of the plate full of vegetables. You want another quarter of it a good lean protein, fish, chicken, turkey, occasionally some lean lamb or beef. You want a little bit of starch. I like my starches to be things that are not white starches and are not fried, things like sweet potato, things like eggplant, wild rice, the Indian red rices, and not all the time. You want to make sure that you have 8 servings minimum of vegetables a day. A serving is a half of a cup. You want to make sure you're drinking a lot of water to flush the system out. You want to get rid of anything that's inflammatory that is a sweetener of any sort. If it tastes sweet in your mouth, even if it's an artificial sweet, it's going to drive your fats, particularly your triglycerides, and it's going to drive your bad fats. So get out and walk. Start walking 2 miles every day. It doesn't make any difference how fast you walk them. Just go walk. And if you do those things, just the things I told you, and you eliminate the junk out of your diet, particularly the sugars and the starches. But my mantra is sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, so forth, all the junk. Get rid of that stuff. Nothing fried. You'll see those markers come down. Taking things like a good natural fish oil and taking in the neighborhood of beginning with 3 grams to 4 grams a day, you'll see things begin to shift. If you're taking a blood thinner, though, or you're taking aspirin, you have to be careful with the fish oils, and you need to have somebody like me that can begin to guide you so you know what the substitution levels are. But yes, the short answer, Charles, is that most of that problem, without knowing more about you, is totally reversible, but I need to know more about you to give you direct guidance. I hope that helps a little bit.
Okay, thank you very much.
You're welcome. Ray, how can I help you? Thank you for calling, sir.
Sure. I really don't need any help. I just heard your show and was actually intrigued because I follow this a lot. I actually follow a nutritionist out in Marshall, Virginia. She puts out a blog, and she always talks about real whole foods.
That's right.
Which is kind of, her term is real whole foods, which is nothing processed, nothing changed, and all that.
No, it's the way my grandmother used to. His grandmother used to raise it in the backyard. The natural fertilizers, and you clean them up, and you make sure that they haven't been adulterated. You make sure the seeds that you're getting are coming from organic storehouses, and you eat that type of food, and you balance your foods, and your body does really well.
Absolutely, and the same thing. I would say that your comment about starches, to me, they're almost really just sugars. Because when you look at, I actually read this book called The Great Cholesterol Myth.
Yes.
It was written by a cardiologist and a nutritionist, and they were talking, and again, a lot of the same things you said. It's not cholesterol that's bad in and of itself. It's the sugar at any kind of
the reason, Ray, is that sugar is inflammatory. It's one of the most inflammatory things you can put in your body, and anything that converts into sugar quickly is inflammatory. So if you have a little bit of a starch like a wild rice or a very hard cut brown rice, occasionally it's not going to. But you want the greatest majority, 75% of your diet needs to be vegetables and lean proteins and so forth, and you're good to go, and you get some exercise on a regular basis. Now, obviously, that's broad brush, and individuals have to be tweaked according to their lifestyles, according to their health risks and so forth. But absolutely, you're right on target. Ray, thank you for calling. I appreciate your commentary. Irene, how can I help you?
Well, I just want to say that your show is absolutely wonderful. I just wish it was on 3 hours instead of 1 hour.
Listen, if you know anybody from Cumulus, that owns WML, give them a phone call. Maybe we can make it happen.
Okay, sounds wonderful. I subscribe to the Natural Way of Health, a newsletter by Dr. David Brownstein.
Yes, good guy.
And he had one item that I'm very concerned about, whereas you add 90 to the person's age to get your optimal blood pressure.
at the top end, systolic pressure.
Correct.
And there's a lot of studies out there that say that as we get older, we need a little bit more push to get through the arterial system. And that it's not the upper pressure, it's not the systolic pressure that's the most dangerous one, it's the diastolic. The diastolic pressure, the lower one, is the residual pressure that's left in the arteries after the heart finishes its contraction. So when you get that lub-dub, which you're going to hear on anybody's heart when you get a stethoscope, if you have somewhat of a healthy heartbeat, it's how hard the phase just after that is, how much pressure is left in the tube, if you will. That's the one that is the most critical. So if the arteries can relax, even though that there may be a greater push, then there's really no danger. So Dr. Brownstein's correct on that. And by the way, I know and I have met Dr. Brownstein many times over the years.
Okay, wonderful. And now, is your practice similar to his?
Dr. Brownstein is a medical physician, and he does functional medicine with nutritional products. I'm a chiropractor, acupuncturist, and a nutritionist, and so we look at things the same way that he does, but we integrate other pieces as well. We integrate the energetic paths. We look at the neurology of the body. We try to see what's happened to the patient from a multidiscipline point of view.
Okay.
Irene, thank you for your phone call.
Thank you very much. Have a great day.
You too.
Bye.
888-630-9625. We're talking about some interesting topics, things that should get your attention very quickly, and if they don't, then you're asleep, and, shame on you for not taking care of your health. In today's marketplace, you have to be very careful. You have to be your own steward, if you will. You have to be the one that is going to pay attention to what's being said, what's being done, and if you don't, who's going to do it for you? It's not going to be, the great white tower doctor out there. It's not going to happen. Interesting article as well that came out about heart failure, and from transplant, it said from the transplant list to health, and it's just one guy's story, and basically what it's about is that. And I'm going to quote this for right now. Few people in the world of medicine, even fewer in the world of cardiology, have ever taken time to even consider, no less test, this proposal that congestive heart failure is primarily caused by beriberi of the heart and or prescription drugs. I've personally tested it and found it to be true in tens of thousands of patients over a period of more than 30 years. And this is coming from a guy by the name of John Lamondola, a PhD professor that was head of a huge study. So having said that, if that's true, and beriberi is basically a vitamin B deficiency problem, if we take vitamin B, full complex, natural sources, not a synthetic source, will it begin to restore and change certain conditions? Well, there's a guy that I've looked at for a lot of years, and he's no longer on this planet, but it's Weston A. Price. And if you go to the Weston A. Price Foundation, they're a little over the edge even for me, but nevertheless, they come up with some very interesting conclusions when it comes to the problems that we have today, and basically says that most of our problems are dietary and stress related. And then you add injury on top of that, and you really have a why for and why is it type of situation. So there's a lot of lessons that can be learned along the way. Cholesterol does not cause heart disease, and that's what I want you to understand. Your high cholesterol is not the problem when it comes to cardiac plaquing. Now, when you drop your cholesterol down, obviously your risk level, having a lot of different things happen, are less. But the problem is that we're looking at the wrong target. We want to look at inflammation. If the inflammatory levels are too high, if your markers for inflammation are above and beyond, even little bits of fat are going to screw things up. You know how statins work? They poison your liver into stop producing cholesterol, because cholesterol is produced in your liver. What's that all about? You have to make sure that you know what it is that you're being told. And if you don't know what it is that you're being told, then again, shame on you. Go find out for yourself. Do the research. It's there. It's simple. It's easy. It's easy to be understood. Diana, thank you for calling. How can I help you?
Yes. I I had an ablation done, and I was taking Toprol, 50 milligrams for a while, but my doctor weaned me off it, and I'm not taking anything at all.
Good for you.
But I do get a lot of edema in my legs.
Well, what you're getting is cardiac congestion, and obviously you had an AFib problem, and atrial fibrillation is the atrial chambers are what pushes the blood into the large chambers of your heart, the ventricles, and then the ventricles, one pushes it into the lungs to get it oxygenated, goes back into the other atrium, and then it pushes it down into the left ventricle, and your left ventricle, the left side of your heart, pushes it out throughout your entire body. So that's how it works. It's lub-dub, 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 and that's the ongoing game. So the fact that you're getting some swelling in your feet and your ankles, that's a cardiac congestion, cardiac failure type of problem until proven otherwise, but it can be lymphatic congestion as well. So they're tied together. There are a couple things that you can try. Increase your vitamin B complex. Go get a natural form of vitamin B, natural form, organic form.
Yes, I do take every day B12.
But that's not the whole complex. And
B6.
And that's not the whole complex.
Oh, so what should it be?
You need to have a complete B complex. Just go to health food store like Whole Foods or whatever and ask them and try it. Take 3 a day. Add a good natural form of fish oil. And since you're not taking any other medication, you can take probably 3-4 grams a day without any trouble. Just divide it up. And see what happens. Now, your B complex is critical, and you want to make sure that your magnesium and your potassium levels are adequate. So, without knowing and having seen any testing on you, what I would say to you is, again, go to the health food store, find a magnesium and a potassium combination that is the aspartate form. So magnesium aspartate, potassium aspartate.
Yeah.
And
I am taking those on my own. I buy Nature's Bounty, and I ran to look at my fish oil, which is Nature's Bounty brand, and it says purified to eliminate mercury, PCBs,
so they're processed foods. You can't do processed products. They don't work. That's what we were talking about earlier in the show.
That's why I'm asking. So this is not the one that I should take.
No.
Okay.
Nature's Bounty, in my opinion, is not one of the better companies out there.
Oh, okay.
But there's some out there. I'm not going to mention them on air because they don't pay for the program. So, but if you send me a note, I'll give you some direction and I'll tell you where you can find them.
All right. Wonderful.
Diana, thank you for calling. I appreciate it.
Thank you. Bye-bye.
888-630-9625, talking about some very interesting things. We're coming up to a break. Don't go away. This is Dr. Tom Roselle. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, Washington.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live in studio every Sunday, 12 noon, to entice you, to tweak you, to get you to think differently, get your brain outside the box so you can take care of your own health. Remember, that's the title of my book. That's why I wrote the book. Ageless Health, Health is a Do-It-Yourself Program. And if you don't have a copy of it, shame on you. Pick it up. You can go to our website at rosellecare.com. You can get it online as well. You can go to Amazon, but it's there available. Buy the book and use it as your Bible, as your guide to restoring, recapturing your own health. Let's go to the phone. Steve, how can I help you?
Doctor, you say get the full B complex and other things, but you don't tell us what foods to eat to get them, and then you criticize us for taking pills.
Well, there we go, right? So I got to step up to the plate. So here's the deal with vitamin B. You know, B complex is a combination of, I think it's like 8 different vitamins, and they're known as the B complex, and it's found in very naturally occurring high-protein types of foods. Leafy greens are another natural source, but it can...
What foods are they?
Hang on. I'm getting there, okay? So traditionally, grains have a lot of B complex if you get a whole grain, but the problem is the high levels of gluten that's in most grains today, and most people are sensitive. So where else can you get them? You can get them wild-caught fish, salmon, trout, catfish, tuna, halibut, codfish.
And how often are we going to eat that in a week?
Well, you should be eating. I eat fish and some sort of fish almost 4 to 5 days a week. I don't eat a lot of red meat, but you can also get it in lamb. It has a very, very high level, and also in beef and shellfish. If you're not sensitive to it, eggs have B complex, and natural dairy products. If you can get raw milk, but do it from goat or sheep. So those are the basics. But some grains have them. If you can get a whole cut rice, they've got them in there. But if you're not allergic, if you're not sensitive to gluten, then periodically put some grain into your diet. We could talk about this really for probably the entire show, but that's a guideline.
But Doctor, what you're giving me is kind of generic things, not specific things that I can go to the store and buy.
Well, my friend, you can go buy salmon, you can go buy trout, you can buy halibut, you can go buy the grains that we were talking about. You can buy
what grains are they?
Grains, I just told you. I told you about rice, whole cut rice, brown rice. That is a natural small cut brown rice. You can get the Indian red rices. They have them in them. The wild rices, they have that in it. We can't do a dietary consulting session on you here on the program, but we're trying to give you at least the guidelines for you to go out and do the study. If you'd like more help, obviously that's what our nutrition department's about in our office, and we'd love to have you as a patient. Come on in, give us a call, and our staff will work with you. And as we go through the programs, I'll try to add more and more information so you can help yourself. But generally, B complex is a compilation of 8 vitamins, and you need to know that. And many are processed out of the foods when you have anything that is white. So you have to make sure that you're getting whole food substances. But you can go to the store and you can get salmon, you can get trout, and you can get poultry, and you can get beef, and you can get eggs, but natural organic substances. Don't get junk in your diet ever. You have to make sure that it's available to you. That should help you. That should make a difference. You want to make sure that foods are clean, and that's where it is. And if you think there's a deficiency, if you can't get enough food in your diet on a day-to-day basis, that's when you need to start supplementing with a good natural B complex. It's one of those things that diet is based on individual lifestyle. Diet is based on health conditions, the type of medications that you're taking, because there are tons of meds that deplete the vitamins from your body, and you end up with increased deficiencies. When we're talking about statins, coenzyme Q10 is one of them. It allows the muscles to misfire. It causes you to go into fibrillation. It causes your muscles to jump. It causes them to ache and hurt. We're here every Sunday, and I'll be here next week. Same old time, same old place on the dial. Make sure you're here with me. This is Dr. Tom Roselle. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the Bowtie Cinema 11 at Reston Town Center on Sunday, March 23rd at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.